Good morning. Welcome to Duber Medical. I'm Dr. Morris, Chief Medical Officer. Today we're going to talk about an introduction to the strains of cannabis. Cannabis as a medicine is why we're here. The entirety of the plant and the different portions give us a range of possibilities to treat a range of diseases for many patients. Different patients have different symptoms. Some patients need different medicines. I say different a few times on purpose because life is not always the same all day long. You may need different types of your marijuana products for different situations or different symptoms. So let's begin with the basics. What does come from the plant? What does help us? Cannabis as a medicine has the active ingredient that is called tetrahydrocannabinol. THC is the abbreviation. There are 3 strains that we choose from every time we choose a product to use to treat our condition. The 3 strains are Cannabis sativa, Cannabis indica, and Cannabis hybrid. Basically, 2 of them function quite as opposites, and 1 is in the middle. Now, it's not that extreme, but we're going to talk about it as if it's extreme first so that we can remember it. 1 of them speeds you up, 1 of them slows you down, and 1 is a nice happy compromise in the middle. The easiest way to remember it is somewhat of a little joke from the kids, but easy to remember. Cannabis indica. How do you remember it? Indica puts you in the couch. Now, it doesn't really knock you over into your couch for the rest of your day, but it means it's the strain that has the more sedating effects. You're going to tend to want to use those strains in the evening, or if you want to have more calming effect. The opposite of slowing down is speeding up. S for speeding up, S for sativa. Cannabis sativa is the one that tends to speed you up. Many patients prefer sativa for their mornings, before they go to the gym for a workout, or when they're doing other exercise. Patients also like sativa for creativity. But just like the indica has a downside of being too sleepy, the sativa can have a downside as well. Sativa can, in cases, trigger anxiety. So we ask our PTSD patients to stay away from sativa at the beginning. And that leaves our friend in the middle, hybrid. Hybrid was a cross strain developed years ago to have all of the goodness of the marijuana products, your anti-inflammatory, your pain relief, and your anti-anxiety, but without having those extremes of speeding up or slowing down. So in summary, 3 strains to pick from, depending on what symptoms you're treating at what times of day, or what your underlying disease is. That's just a brief introduction. Come to Duber Medical and learn more. Our doctors will help guide you through these choices so you learn what works for you, because we want you to heal better and feel better. Thanks for visiting Duber Medical.